More than 70% of strokes strike in the early morning. According to the CDC, in 2024, it doesn't happen out of nowhere. During the night, blood sugar and blood pressure swing up and down. Medicines keep working in your body and can build up to stronger levels. You naturally lose water while sleeping, which makes blood thicker. And if you deal with acid reflux, lying flat can push acid upward and cut off oxygen supply. All of this creates a fragile moment just before sunrise. But here's what most people never realize. The fruit you choose before bed can quietly make things better or worse. After 60, your body handles sugar, potassium, and acids differently than it used to. That late-night bowl of fruit might spike blood sugar, interfere with your prescriptions, or even disturb your sleep. It sounds harmless, but the wrong fruit at the wrong time can push your body closer to stroke risk by morning. The good news? By knowing which fruit traps to avoid, you can protect your independence, keep your morning strong, and wake up ready to live on your own terms. Number 1. Grapefruit, Seville orange and pomelo with medications. Grapefruit may look refreshing, but for older adults on daily prescriptions, it can be a dangerous mix. This fruit, along with Seville oranges and pomelos, contains compounds called furanocoumarins. These natural chemicals block an enzyme in the liver known as CYP3, a 4. That enzyme's job is to help your body break down many common drugs, especially heart medications, cholesterol-lowering statins, and certain blood pressure pills. When the enzyme is blocked, the medicine doesn't break down the way it should. Instead, it builds up in your bloodstream, making the dose much stronger than your doctor intended. According to the FDA and the NIH, even a single grapefruit a day can triple the concentration of some medications. That can lead to dizziness, sudden drops in blood pressure, or dangerous side effects you never saw coming. The tricky part is that you might not feel anything right away. But over time, the combination of grapefruit and your prescriptions can quietly push your body toward a crisis. If you love citrus, the safer choice is to switch to regular sweet oranges, mandarins, or tangerines, which don't carry the same drug interaction risks. The key lesson here is simple. When you're managing your health after 60, it's not only about what you eat, it's about how it works with your medication. Sometimes, one fruit can turn a helpful pill into a hidden danger. Number 2. Orange juice and medications. A glass of orange juice might seem like the perfect way to start or end the day. But if you drink it too close to your medication, it can cause more trouble than you realize. Unlike grapefruit, orange juice doesn't block enzymes in the liver. Instead, its natural sugars and acids can interfere with how your body absorbs certain drugs. For example, research from the NIH shows that orange juice can reduce the absorption of some blood pressure and cholesterol medicines by as much as 40%. That means the pill you rely on may not work as well, leaving your heart and blood vessels less protected. And because orange juice is high in fast-digesting sugar, it can also cause a sharp spike in blood sugar. For older adults, especially those with prediabetes or on insulin, that quick jump can lead to dizziness, lightheadedness, or even nighttime blood sugar crashes. Drinking orange juice right before or right after medication adds another layer of risk. Sudden swings in blood pressure combined with sugar highs and lows. The CDC recommends spacing juice at least 2 hours away from your prescriptions to keep your medicine working as intended. If you enjoy citrus flavor, try eating a small whole orange with breakfast. Instead, it has more fiber, a steadier sugar release, and fewer risks of drug interference. The bottom line? It's not about giving up orange juice forever. It's about timing it wisely so you get the benefits of both your fruit and your medication without the dangerous side effects. Number 3. Mango and dried mango. Mango is sweet, tropical, and feels like a treat. But for adults over 60, Especially those watching blood sugar, mango can be a hidden trap. 1 cup of ripe mango contains around 45 grams of sugar, according to the USDA. That's nearly the same as drinking a can of soda. Your body digests that sugar quickly, causing a sharp blood sugar spike. And when blood sugar rises fast, insulin surges to bring it down. These rapid swings don't just make you feel tired or shaky. Over time, they damage tiny blood vessels in the brain, eyes, and kidneys. The danger gets even worse with dried mango. Because all the water is removed, the sugar becomes highly concentrated. Just a handful of dried slices can pack more than 60 grams of sugar without making you feel full. For older adults, eating mango at night can mean high blood sugar followed by a crash while you sleep. That combination stresses blood vessels and increases the risk of early morning stroke. If you love the flavor, portion control is key. Limit yourself to just a few fresh slices during the day, paired with protein or fiber to slow the sugar rush. And when you crave dried fruit, swap it for a small handful of nuts or berries instead. Mango isn't the enemy, it's the dose and timing that matter most. Because after 60, every spike and dip in blood sugar puts extra strain on your brain and heart. Number 4. Grapes by the bowl. Grapes are small, juicy, and easy to snack on. That's exactly what makes them risky. Most of us don't stop at just a few. A single serving is about 15 to 20 grapes. But when you grab a whole bowl, you might eat 50 or more without noticing. That can add up to 60 grams of sugar in one sitting, the same as 5 spoonfuls of table sugar. Because grapes digest so quickly, that sugar rushes straight into your bloodstream. The result is a sharp spike in blood sugar followed by a crash. For older adults, especially those with high blood pressure or prediabetes, these swings can trigger dizziness, headaches, or even irregular heart rhythms. The timing makes a big difference too. Eating a large bowl of grapes late at night can push blood sugar up while you sleep, then drop it down suddenly by morning. That roller coaster puts extra stress on the brain and increases stroke risk in the early hours. The smarter move is to treat grapes like candy, small portions, not bottomless bowls. Stick to a handful and try pairing them with cheese, yogurt, or nuts to slow down the sugar rush. That way, you still enjoy the sweetness without overloading your system. The key lesson? With grapes, it's not just what you eat, it's how much and when. Too many at the wrong time can quietly turn a healthy fruit into a hidden risk. Number 5. Overripe bananas. Bananas are often called the perfect snack. But when they're very ripe, the story changes for older adults. As a banana ripens, its starch turns almost entirely into simple sugar. That means a soft spotted banana digests quickly and pushes blood sugar up faster than a firm, just ripe one. But sugar isn't the only concern. A large banana also delivers around 450 milligrams of potassium, according to the NIH. For most healthy people, potassium is good for the heart and muscles. Yet for anyone with kidney disease, or those taking potassium-sparing drugs like spironolactone, ACE inhibitors, or certain blood pressure medications, too much potassium can build up in the blood. This condition, called hyperkalemia, may not cause early symptoms, but it can suddenly trigger dangerous heart rhythm problems, even cardiac arrest. The BMJ reports that older adults with reduced kidney function face a much higher risk when their potassium intake climbs beyond safe levels. That's why eating an overripe banana late at night, especially if you're on these medications, can quietly add stress to your heart while you sleep. The safer option is to choose a smaller, just right banana earlier in the day, and pair it with protein like yogurt or peanut butter to slow down the sugar surge. Or rotate with lower potassium fruits such as apples, berries, or pears. Remember, bananas aren't bad, but the ripeness, the size, and your medication history matter. Because after 60, Protecting your independence means paying attention not just to what you eat, but how your body handles it. Number 6. Watermelon. Watermelon feels light and refreshing, but eating it late at night can cause hidden problems after 60. This fruit is more than 90% water, which means a large evening portion almost guarantees extra trips to the bathroom. For older adults, especially those taking diuretics or water pills for blood pressure or heart conditions, that can mean waking up multiple times through the night. Interrupted sleep isn't just tiring, it raises stress hormones and weakens blood vessels over time. And every bathroom trip pulls more fluids and electrolytes out of your system. The result is mild dehydration by morning, even if you don't feel thirsty. When the body is low on water, the blood becomes thicker, making it easier for clots to form. A study in Lancet Neurology showed that dehydration significantly raises the risk of stroke, particularly in older adults. Now combine that with the natural early morning rise in blood pressure, and the danger is clear. What seems like a harmless slice of watermelon at 10 p.m. may be setting you up for a difficult morning. If you love watermelon, the safer choice is to enjoy it earlier in the day, ideally with lunch. Pair it with a bit of protein like a handful of nuts or cottage cheese to balance the sugar rush and keep you full longer. That way, you still enjoy the sweetness and hydration without the risks of midnight bathroom trips, dehydration, and thickened blood. The lesson is simple. After 60, the time you eat matters as much as what you eat. And with watermelon, nighttime is not the right time. Number 7. Pineapple. Pineapple is tangy, juicy, and packed with vitamin C, but for older adults, it hides a risk many people overlook. This fruit contains an enzyme called bromelain. Bromelain has mild blood-thinning effects, and when combined with prescription anticoagulants or antiplatelet drugs like warfarin, aspirin, or clopidogrel, it can make your blood too thin. That raises the chance of easy bruising, nosebleeds, or in rare cases, more serious bleeding events. The NIH and FDA both note that interactions between foods and blood thinners are often underestimated, and pineapple falls into that category. Eating pineapple late at night creates another problem. Its natural acids can trigger acid reflux while lying down. Reflux doesn't just disturb your sleep, it also reduces oxygen levels, forcing your brain and blood vessels to work harder overnight. Poor sleep itself is linked with a 33% higher risk of stroke in older adults, according to The Lancet. So, when you combine the potential for reflux, poor oxygenation, and stronger blood-thinning effects, pineapple before bed becomes more of a hazard than a treat. That doesn't mean you can never enjoy it. Have small portions earlier in the day, and pair them with a meal rather than eating pineapple alone. And if you're on any blood-thinning medication, it's worth asking your doctor whether this fruit should stay on your menu. The key is balance and timing. Pineapple can be part of a healthy diet. But for those managing medications and sleep, late-night indulgence can quietly add to morning stroke risk. Connection. Why small habits add up? These harmless little habits don't hurt you all at once, but repeated every day, they quietly weaken the blood vessels in your brain. Think of it like drops of water hitting the same spot on a stone over time. Even the hardest surface begins to wear down. When you fall asleep, your brain already receives less oxygen than during the day. Add a sharp spike in blood sugar from late-night fruit, sudden swings in blood pressure, or mild dehydration, and the stress on your circulation multiplies. Now picture what happens if you also take medications that interact with certain fruits. Instead of being controlled, your blood becomes unstable, too thick, too thin, or moving with the wrong pressure. This is why so many strokes are recorded in the early morning hours, after what seemed like an ordinary night's rest. It isn't one single mistake, it's the buildup of small choices made again and again that finally tips the balance. And the good news is, once you understand the connection, you can start protecting your brain and heart with simple changes every evening. So, here's the simple takeaway. Every evening habit you build shapes how your brain and heart will feel the next morning. And when it comes to fruit, 3 checkpoints can make all the difference. First, fruit and medication. Avoid grapefruit, pineapple, or orange juice too close to your prescriptions. Give your body at least a couple of hours to process safely. Second, timing. Skip heavy sugary fruit late at night. That's when spikes in blood sugar and reflux can do the most damage. Third, portion and pairing. Keep it to 1 or 2 small servings. And balance fruit with protein or fiber to steady your blood sugar. These aren't big sacrifices. They're small shifts that protect your independence, keep your morning strong, and lower the risks that quietly build after 60. Now it's your turn. Take a moment tonight to look at your fruit routine. And if you've already checked these 3 points, type "checked" in the comments. That way, you remind yourself and inspire others that protecting brain health starts with everyday choices. And if you found this helpful, don't forget to subscribe for more practical, science-backed tips to stay strong, sharp, and independent.